Health equity means increasing opportunities for everyone to live the healthiest life possible, no matter who they are, where they live, and how much money they make. Without health equity, there are endless social, health, and economic consequences that negatively impact individuals, communities, as well as organizations. As the preparedness starts at a country level and comprises many elements, first and foremost, it requires a strong and a resilient health system. We are Team 4.
Risks are composed of three factors: threats, which are constant, like viruses; vulnerability; and capabilities, which can be worked at the individual level. So our three recommendations are based on this last factor. The first of them is implementation of community councils, based on the idea that communities are the health creators themselves and not just users. We propose to establish community councils in vulnerable communities that function as a network of support and encouragement, and that allows people to learn and become empowered. Based on four pillars. The first one, education, that includes gathering the views of the community, not just sharing information, providing primary health care by primary health workers of the community itself, and prioritizing the interests and needs of the community. Whatever the community needs, that's the priority. And taking care of vulnerable groups, starting by implementing violence recognition protocols.
Our suggestion is based on three main topics. First of all is trust, which was found in a study that made amongst households in the Philippines, which found that when training community members, they are used more as a source of information, and that respondents who reported higher levels of trust in their neighbors identified and adopted more preventive measures. Empowerment, which can be seen in the study conducted in sub-Saharan Africa, where they found that more empowered patients and caregivers are able to identify better quality clinics and negotiate for better quality services. And finally, education, which can be seen in the study carried out by training native patient navigators in order to provide better cancer education in their community, which show that one can educate laymen to provide high quality education. This has benefits of empowering communities and individuals to be active participants in their own health and creating local experts. However, when carried out incorrectly, one can perpetuate in traditional gender roles, and if there isn't adequate supervision, then this knowledge transmission could be influenced by prejudices in these communities.
A key role to sustainable financing for health is to support health systems to achieve universal coverage by reducing health inequities and minimizing financial hardships on the poor. That's why we recommend that basic income guarantee should be implemented.
A basic income guarantee is when income is supplemented to ensure that all citizens of a population are able to afford basic needs such as food, housing, clothing, and other necessary resources. Basic income can be adapted to different communities and their needs. There have been numerous pilot projects testing income supplementation in all continents. Income supplementation has shown to improve literacy, increase school enrollment, and reduce dropout rates. It also increases access to affordable and adequate housing, which is associated with decreased infection from communicable diseases. Overall, income supplementation can decrease hospitalizations and doctors' visits due to improved health. This recommendation has the potential to improve health in multiple ways, since income also affects housing, sanitation, education, and mental health. It has a large impact because it targets socioeconomic factors and involves populations. A limitation is that this recommendation would take time to implement because it involves policy changes.
So, our third recommendation is the improvement of health education in elementary schools. It's well known that more years of schooling is associated with better health, but we propose to focus not only in the number of years, but also in the quality of years. This is why we recommend the inclusion of health education as a subject in primary education. The benefits are that it lets the student to understand illness and avoid it from an early age, giving the skills needed to adopt healthy behaviors, and the students are at an age where the habits are easier to create. The limitation are the precise number and sequence of lesions have not been clearly defined.
The evidence in general shows this. Education develops skills, values, and attitudes to enable citizens to lead healthy lives, making poor decisions and address local and global issues. Childhood is an extremely sensitive time for a number of medical issues, especially when it comes to adopting healthy behaviors that can have lifelong consequences. Also, the CDC provides the National Health Education Standards, which point out what students are expected to manage with the inclusion of health education.
These are the references. And all the recommendations that we presented here will help in achieve the health equity. And we are very hopeful that if the young and the passionate people will effectively play their role in achieving their goals, whatever the small, how much small they are, then we can definitely decrease the long-term effect of future pandemic. Thank you so much.